I'm very behavioral in therapy. I want to know that, what I'm doing is working. I want to know that we are making like clear steps towards clients' goals. What's progress and how do we know we're making progress? For Ava, as we talked, she really wanted to start transitioning. And for her, that meant getting a voice therapist. That meant learning more about gender affirming hormones, specifically estrogen. She didn't have awareness of like how to even get connected to a provider. And that meant telling more people about her gender identity. So we set very specific goals. One of the most, foundational tools for developing a new skill, new habit, behavior change is setting SMART goals: specific, measurable, achievable, relevant, timely, and also monitoring our progress towards that. And we did that with transitioning related steps, and specifically with voice training. We started, monitoring every day. Did she practice the 30 minutes a day like she wanted to? Yes, no. And she'd come back to every session with, this is exactly how many days I did it. Even if we feel like we have a lot of awareness around our behavior, there's something about monitoring, tracking our goals that helps us be more mindful of it. We have to think about it every day. It keeps us on track. It keeps us more accountable. And we set goals around transition-related steps. There can be a lot of discomfort for people who are voice training. It can be a source of dysphoria. There's a discordance between how they sound and how they wish they sound, discordance between their identity and their voice. And that can be really dysphoric, worrisome, embarrassing for people. They might feel. One of the things that we did in therapy was therapy then became this space to where she could show a little bit of vulnerability, step into the anxiety, step into worry or fear, and practice her voice, her feminine voice in session itself. And that became another gradual step of exposure, committed action, even though it's tough, it's difficult, it's awkward. It was important enough for her to do to transition that she began doing it in session. And it also became another way for her to practice her voice. What I noticed with Ava was, given her tendency towards a little bit of anxiety and worry, as we began talking about next steps in transitioning, reaching out to medical providers, making phone calls, she found that she would worry a lot. She would sit there for about 15 minutes before making a phone call, and end up not making a phone call or being really worried or not asking for the quite the right thing she wanted to ask to, because she didn't want to be a burden to the medical provider. So she would notice things in her body, high heart rate, lots of racing thoughts, worry she's going to say something wrong. She would have thoughts of I can't make this phone call, or it's too difficult for me to make this phone call. What I like to do in therapy is draw attention more to our language, kind of diffuse from specific wording, specific language. Oftentimes people will say things like, I'm too anxious, I can't do X, I can't make this phone call. I'm so worried about, being fired. I'm so worried about people rejecting me that I can't try on the clothing I want, or I can't transition. Language has a huge effect on us. If I were to describe to you in great detail a cheesecake and how juicy and sweet it is with raspberry syrup on top, our mouths might literally start to salivate, might start to water. It's the same thing with a lot of our thoughts. Sometimes we can act so on autopilot and just take the thoughts as true, and when really maybe it's just a thought, and maybe it's not a really helpful thought. In ACT, we're concerned with the utility of a thought. Does it get us where we want to be? Not necessarily with the truth value of that thought. Is it true or false? So what I ask clients to do, what I ask Ava to do is, when you notice yourself having that thought of I can't make this phone call, or I would, but ask them to shift their language. Can you say, I want to make this phone call? It's difficult for me to make this phone call because I'm having racing thoughts, or not that I can't make this phone call, but I want to make this phone call and I'm choosing not to because I'm worried about saying something wrong. Can you change the but to an and? I was going to make the phone call and I'm so anxious. I'm, worried I'm going to say something wrong. There's a difference there where it becomes a little bit more of a, less of an excuse, more of a choice. People can have a thought about saying something wrong, about doing something embarrassing, and at the same time, still make that choice if it's important enough to them. We got to learn how to look at our thoughts and feelings and words a little bit differently, especially for those that don't really lead us in the direction we want.